Hi, I'm Dr. Patrick Foy. I'm an MD or medical doctor, and I'm the director of the Coccyx Pain Center or Tailbone Pain Center here in the United States, online at tailbonedoctor.com. And this is the next in a series of videos looking at the different chapters in my book, Tailbone Pain Relief Now. And the idea is just to get a glimpse as to the general material that's covered within the different chapters, which then provides us with an opportunity to talk about those areas and to post questions and comments down below to have a dialogue about this. This chapter for this video is chapter number 6, which I think is perhaps the most important chapter in the book because it's about unstable joints of the coccyx or tailbone. And the reason I say it's perhaps the most important chapter is for two reasons. Number one is that this is perhaps the most common cause of tailbone pain. Certainly in our practice here, patients fly in from around the country and internationally, and far and away the most common diagnosis that we find is that they have instability, an unstable joint or more than one unstable joints at the tailbone. And the second reason why this is such an important topic is that this is an area that is widely underdiagnosed. The vast majority of people who have this condition have never had the proper testing done to evaluate for it. So in this chapter, again, we're looking at here, chapter 6, unstable tailbone, which is basically that the joints are unstable, and that contributes to a condition that medically we call that instability, and specifically dynamic instability, which we'll talk about. So in this chapter, starts off with a story of a patient, like hundreds and hundreds of patients who I've seen, who've been told that there's nothing wrong with their tailbone, that everything is fine, that the plain x-rays and even the MRI or CT scan looked okay, but the patient failed to have a sitting versus standing x-ray done. So given that your pain with tailbone pain is usually worse while you're sitting, the x-rays really should be done while you're sitting. But unfortunately, very few places know about how to do those properly. Very few radiology centers or hospitals have even heard of doing these x-rays of the tailbone while sitting. So that means that they don't get done. And because they don't get done, we don't get to see what happens to the tailbone when you're putting your body weight on it by sitting. When we sit, sitting down puts pressure onto the tailbone, and the tailbone then may move or shift depending on the pressure that's placed upon it while sitting. What can happen is the following. You can have x-rays that look totally normal while the person is standing up or laying down. They're not putting their body weight onto the tailbone, as shown in this part of the image here. The alignment looks okay, everything looks fine. But then when the patient sits, the body weight pushing on that unstable joint can cause the joint to go into a partial or complete dislocation position, as shown in this part of the image here. So this is very, very common. There's I would say at least 60% or more of the patients who I see for tailbone pain have instability. They have hypermobility is another way of referring to this. Hyper means increased, mobility is just talking about the motion. So a couple of medical terms that are saying the same thing. It might be described as hypermobility or instability, or coccygeal, just referring to coccyx, hypermobility, coccygeal instability, sometimes referred to as dynamic instability, the dynamic part being that the tailbone is not just dislocated, but it's actually moving, it's dynamic. It's in one position while you're standing up or laying down, and it's in a different position when you're putting your body weight on it by sitting, and especially if you're sitting leaning partway back, that puts even more of your body weight and pressure onto the tailbone. In the chapter, that chapter 6, really super important, because for people who are suffering with tailbone pain, if you have not had an evaluation to see if you have dynamic instability, hypermobility, again, all saying the same thing here. If you have not had that evaluation done with sitting versus standing x-rays, really you have not had the appropriate or adequate testing to find the cause of your tailbone pain. So the chapter goes into a lot more of the details. Really the point of the video is just to give you a taste for the topic, and that allows us to have more of a dialogue in the comment section down below. For more of the details, there's certainly in here about different types of dynamic instability. This showed one type, which is where there's what's called listhesis or sliding, but there's other types as well. There are patients who have the tailbone that flexes too far forward or too far backwards, which we can show that on this model. This model is a little worn down from over the years, but if you sit and the tailbone flexes or bends too far into the forward position, or in some patients it actually extends in backwards, those are other examples of increased mobility or hypermobility. Any of those can be painful because when you're having that increased movement at the joint, then you're having extra mechanical stress and forces and pressure on the joint, which can be very painful. Just like if my thumb was going into this kind of a dislocation, if it was shifting that much, of course it would be painful, and any doctor or clinician would understand that. But at the tailbone, unfortunately, it's a little bit out of sight, out of mind. Physicians are not aware of the of this phenomenon at the tailbone, even though they're well aware of it in other parts of the body and throughout the rest of the spine. So again, it becomes really important to have the appropriate testing done to evaluate for that. There are specific criteria for how much movement there is supposed to be at the tailbone in terms of that sliding or movement forward and backward, up to 25% of the width of the actual bone itself. There's cutoffs also for how much the tailbone is supposed to flex forwards when you sit and put your body weight onto it. The original sources typically say flexing forward by 20 degrees. And again, if it's moving more than the standard sort of normal amount, then that by definition would be hypermobility or increased mobility. So we go into a lot of that here in terms of the different types of hypermobility. The test that can be done, which as we mentioned is the sitting versus standing x-ray. You do the x-rays in the side view looking from both positions while you're sitting and also while you're standing, and then we compare, because that comparison is really what's important to see how much movement there is when you go from one position to another. So that's the general idea. The toughest part, which is actually the last part here, which is where can you find a place that will do this sitting versus standing x-rays, and that becomes a real challenge, unfortunately, for many patients, because again, most radiology departments are not familiar with this. There is information that is available online that will help to give instructions to the radiology centers, or certainly you can share with them the information that's in the book, so that can help you to get things going in the right direction, hopefully. But admittedly, I do understand it is an uphill challenge for places that are not familiar with it to get to convince them to do the appropriate testing. So that's the general gist. There's a lot more detail in here, but I'm trying to keep the videos less than 10 minutes, and really just to provide an opportunity then for us to discuss down in the comments section down below. So post your comments down there, and myself and others can interact and comment on the topic. So if you have questions about sitting versus standing X-rays or the hypermobility at the Coccyx, post your comments down below. If you're looking for a copy of the book, the easiest way to find that is to go to www.tailbonebook.com. And if you're looking to find me online or to come for evaluation here, easiest way to find me is to go to the website www.tailbonedoctor.com. Okay, I hope that's helpful. Post your comments down below. Bye-bye now.